All right, welcome everyone. This is the 10th webinar in the Gender Equity Unit series, Gender, Data, and Equity Expert Conversations. For those of you who are not aware, the Gender Equity Unit is primarily funded by Bloomberg Philanthropies and is part of the Data for Health initiative. We are located in the Johns Hopkins Bloomberg School of Public Health. Um, excuse me. Our work aims to serve as a knowledge center and resource hub for all partners and countries in the Data for Health initiative and beyond to integrate gender equity in their work, provide capacity strengthening activities focused on gender equity for partner liaisons and key country players. And we conduct research studies to demonstrate the importance of barriers to and strategies for advancing gender equity in global public health through data systems. We're very honored to spend the next 45 minutes with our audience from around the world and with our guest, Lauren Tetenbaum. But a few notes at the top. We will have a Q&A session at the end. So please feel free to write your questions in the chat throughout the conversation, and we will save them for the end. At that point, you are also welcome to raise your hand and come off mute to ask a question. We'll also be sharing a very brief survey in the chat to learn more about our audience. If you could take a minute to fill that out. So today I am hosting a conversation with Lauren Tetenbaum, a licensed clinical social worker, women's rights advocate, and the author of Millennial Menopause, Preparing for Perimenopause, Menopause, and Life's Next Period. Acclaimed by menopause healthcare experts, women's rights advocates, and best-selling authors, Millennial Menopause has been called a smart, relatable, and research-backed guide for women balancing careers, relationships, and caregiving while navigating hormonal change. With an extensive background in women's advocacy, maternal mental health, and law, Lauren continues to support and empower women through life transitions. And we love books that have that research backing. So Lauren, welcome. I'm so happy to have you join us.
Thank you for having me. It's an honor to be here.
So first question, last year you released your book. Could you summarize the premise of it for our audience that's not familiar with it?
Absolutely. So this is my book, Millennial Menopause. It is available wherever books are sold. And it is my mission through the book to educate my generation of millennials. Technically, those are people born between 1981 and 1996. But I do like to say and mean that the book is for millennial women and anyone who cares about them. So hopefully people of all ages and stages and backgrounds will pick it up and read it because it explains what menopause is, what perimenopause is, how we might be affected by the symptoms of perimenopause, during which hormonal fluctuations are significant and can lead to significant mental and physical health symptoms. And then the book also has a lot of resources from telehealth platforms to social media accounts to other books and professional organizations so that women can get the treatment options and information that they need and deserve for their specific experiences.
And I find that a lot of people are not familiar with the different stages of the menopausal cycle. So menopause being the end of a menstrual cycle for at least a year, correct?
Right. And by the way, I wasn't familiar either before I started this research. So there are no dumb questions. I am overeducated. I care a lot about women's health, and yet I knew very little about menopause when I started this project. And that's what struck me as the need to learn and to educate my clients, my friends, my community. So you're right, menopause is the end of the period of fertility, of ovarian function. The technical definition of menopause is 1 year of no periods, absent any other health reasons. So it's technically 1 day. And perimenopause is the phase of time leading up to that 1 day. And that's when women's estrogen and progesterone are wildly fluctuating like a roller coaster. Then that leads to the symptoms that we know of, like hot flashes, and that we might not be aware of, like mood swings, itchy ears, and a whole range of symptoms.
And that perimenopause period can last for years and it
Yeah.
really varies by woman.
Absolutely. We used to say it lasts on average 4 to 7 years, but as more research is being done, we are seeing it last for closer to a decade. And that means that it often starts in a woman's late 30s, early 40s.
Yeah, from a personal standpoint, I was starting to
Mm,
notice changes in my body where I just wasn't feeling like myself.
mhm.
And I remember saying to my gynecological provider, like, I think I'm in perimenopause. And her first response was, no, you're too young
Too
for
young.
that.
Yeah.
So it was, oftentimes women have to advocate for themselves when they're starting to feel a little off to really have these conversations with their providers.
Absolutely. And the old way of thinking about perimenopause was based on the menstrual cycle. Typically, it will be shorter in between periods and heavier bleeding, and then eventually it'll be longer in between and ultimately taper off. But many women don't get a period and they're still experiencing perimenopause. And so that's not the only way that we diagnose it, but there is no one diagnostic tool. And many women report exactly the phrase that you just used of, I don't feel like myself.
Mhm. So while you were writing your book, how did you determine the best way to communicate all the research and data that you gathered?
Sure. So I wrote like I talk, very, I think, approachable, and I break things down in a way that is hopefully easy to understand, but extremely informative and well researched. And as a therapist, my clients often describe me as relatable and sort of like a big sister. And I wanted that tone to be represented in the book. And frankly, it came naturally to me because it was my own journey of asking questions on my own behalf, on behalf of the women that I knew, and talking about it in a way that I would talk to girlfriends or my younger sister. And I wanted women to walk away from reading it with a feeling of community and knowledge of, okay, this is happening. I know what it means. I know where to go if I have other questions or specific symptoms, and I'm not alone and I won't be caught off guard. That last bit was something that I had heard from so many older women. And it reminded me of my clients in the perinatal period who consistently say things like, no one warned me about the identity shifts or the hormonal changes impact on my mood. Why didn't anyone tell me? And I thought, okay, well, I will tell everybody.
And I believe you included a how-to guide. Can you talk a little bit about what prompted that?
Sure. I included how-tos for a variety of areas because menopause can impact a woman's life on the whole. So each chapter has specific focuses and there are guides within each. For example, how to talk about menopause and advocate for benefits in the workplace, how men play a role, how menopause is represented in media, how you can talk to your own provider or find a new one, how you can talk to your children is woven throughout, because I think that's really important to normalize the conversation.
Yeah, I love that. The inclusion of children too. Because if you're a parent, especially these days, if women are having children a bit older, maybe closer to that perimenopause phase. And so you are juggling parenting often with those shifts. And
Mhm.
so to be able to communicate that to family members on what might be going on with you, what you need, I think
Mhm.
is really important.
Absolutely. And it helps with the overall destigmatization of it. And I have a son and a daughter, and they come with me sometimes to my book talks and are very proud to support and talk all about women's health. So I hope everyone can do that with their kids.
Yeah, I was going to ask you if you wouldn't mind sharing a little bit on a personal note, like how these conversations occur within your family, or was that something that prompted you to write the book?
We've always been very open in my family about developmental health, sexual health. I have never shied away from answering any questions very directly. We've talked about sex and menstruation and the way babies are made. We say either through sex or science. And it's never been a sit down birds and the bees conversation. And frankly, I don't think it ever can be just the one. I encourage parents to have open dialogues with their kids. And if you're not comfortable, there are resources out there to support you. I understand not everyone is as open as I might be, but kids will learn this stuff probably sooner than we might think. And I am of the mindset that it should come from a trusted adult and probably in the way that you want to relay that information.
That's great. So it seems like perimenopause is having a moment
Mm.
in popular culture. So what have your observations been recently?
So I would say currently, I still think it's menopause that's having a moment.
Mm.
Even in the medical literature, there is more data, more information on menopause, meaning once the cycle ends, once the ovaries stop functioning as they were. And we need more of a data set on perimenopause. And what we're getting is a lot of anecdotal experiences, which are helpful, and observational studies are certainly welcome. But it would be benefit us all to have more of a focus on perimenopause. That being said, anytime women's health is of value in our culture, I welcome it. And it certainly, there's a lot of room for us to grow as a culture when it comes to valuing women and women's health. And I welcome the more studies, the better, the more options, the more resources, the more training programs for all kinds of providers in healthcare, not only gynecologists and primary care physicians, but also neurologists, cardiologists, allied caregivers like myself in as a mental health professional. So we are calling for that, and I hope that the momentum continues to grow.
So I know you're not a researcher, but do you have thoughts on how we can gather more data on the perimenopause experience?
Sure. I think the anecdotes and the observational studies are hugely valuable, especially since menopause itself is going to be experienced differently by each and every woman. So I think surveys and invitations to tell one's stories are always very powerful. And that's kind of what I did through my book. I spoke to 4 dozen professionals in this space and experts in women's health, but also more than 100 women who had been through it or who were preparing to go through perimenopause. So I am a qualitative person, a writer, a storyteller, so I appreciate that. And the randomized control studies always are welcome. I think we need more information on various treatment options. They are currently looking into alternatives to hormone therapies. So we certainly welcome all kinds of medications that can be effective. We don't have a lot of research on supplements and other forms of non-medical options that people do tend to want, and yet currently there isn't a lot of data backing up their efficacy. So I think some conclusions would be helpful there. And also the spreading the information about those conclusions would be helpful. And I think all of this really starts with more education of the providers because what we're currently seeing is the dismissal that you had mentioned. And so, if providers are not even recognizing that perimenopause is upon their patient, they're not going to give the survey or ask the right questions. So, it really does come back to education.
Yeah. Yeah, I mean, when you check in to a medical provider, they always ask, are you pregnant? Are you breastfeeding? When was your last period? But I wonder if women of a certain age would be given supplemental questions asking about some of the most common um, symptoms of perimenopause, just to give us more data on how widespread a lot of those symptoms are.
So I would say, even just have you noticed anything new or different?
Ah,
And
yeah,
because there are so many symptoms of
yeah,
perimenopause, things that surprise me, like changes in allergens and histamines, changes to one's voice, itchy ears, itchy skin. And don't be scared, everyone. This doesn't happen to everybody. But these are potential symptoms, and a lot of women don't know that it's hormone related. So they might not say, oh, yes, I have perimenopausal symptoms. But anything new or different should be raised. And certainly, if it's bothering you, it should be addressed.
yeah.
The Menopause Society did say in one of their recent guidelines that providers should be opening the conversation around perimenopause to all women, all female patients at age 35. That's not happening.
Yeah. Well, I just learned something new from you. I've had changes in histamines and allergens, itchy skin, and I kept
Mhm.
saying to various providers, my GP, my dermatologist, like, is this perimenopause? And they're like, no, I think it's something else. But here, this is a symptom that could
Mhm.
be related to it.
Right.
Um, all right. So more menopause having a moment. Yeah,
Mhm.
I can see how that's the case. And my understanding is that a lot of medical providers, unless they seek out training on menopause, are there's not a lot of attention paid to that in medical schools or, other trainings for nurses, et cetera.
No, there's not a lot at all. Anecdotally, a lot of the providers that I know and work with and have spoken with said that they got a 1 hour lunch and learn. That was
Yeah.
optional. Even the OBGYNs who specialize in women's reproductive health get maybe 6 hours. The studies have shown that less than 7% feel equipped to provide the right support. And I'm in the New York City area, which is very fortunate to have some of the best providers in the world. And again, anecdotally, many of them have been dismissive of even my asking questions. Can you tell me more? And they too have said, oh, you're too young. Don't worry about it.
Mhm. Yeah. So why do you think that is? Because I mean, these days with people living longer, women could potentially spend a majority of their life in the perimenopause, menopause, postmenopausal phase.
Yeah.
So why do providers not get training on this?
Well, I think there's inherent misogyny in our medical system and our culture. I think there's inherent ageism. Women, and goes back to why it's not quite perimenopause having a moment yet. People are afraid
Yeah.
of aging, and women in their 30s hear menopause and think, that's not me. I'll deal with that later. And I understand that, but A, aging is not to be feared, and B, we're all aging, right? Every minute that goes by. And so it is something that we should be aware of, not bury our heads in the sand about. But providers are part of our culture, and I think reflect that in their practice. And there was a study in 2002 from the Women's Health Initiative that was stopped prematurely. And essentially, the data was misinterpreted such that fear was spread around hormone therapy, which is the primary way to treat these symptoms. And the messaging became hormone therapy is dangerous, it causes breast cancer and heart disease. And so providers and training programs were essentially of the mindset that if there's nothing to do to treat it, we don't need to learn about it.
Mm. Yeah. Yeah.
That's wrong, to be clear.
I won't I won't go on a rant, but yes, very frustrating.
Yes.
So How do you think that media representation affects our cultural understanding and stigmas of perimenopause and menopause?
I think media plays a huge role in American culture, and unfortunately, I think media likewise reflects the ageism and misogyny that we see in all levels of our society. We don't typically see older women, and by older, I mean midlife, 40s, 50s. So that's not old. But we don't typically see that age represented on screen. The Gina Davis media organization has done some great work on this topic, and they've released data that's really just upsetting because it reflects that women are not reflected. And when we do have a menopausal character, she's usually a bit of a fool, kind of hot flashing and maybe moody, but it's that old trope of, oh, a hormonal woman. And in reality, yes, women are hormonal and that's okay. And let's figure it out and support her with whatever she needs and not make fun of her. But that's been the standard trope. I do think that especially with novels, we're seeing a little bit more representation and more acknowledgement of this phase of life. So I hope that that continues to grow.
Mhm. Yeah, and I've seen more emphasis on women having success later in
Mm.
life, like the 50 over 50 type of campaigns or awards. But yeah, then also talking about how women feel during those stages, how the hormonal shifts might impact them. Um, can you talk a little bit about how those shifts can affect women in their work?
Sure. So I'll take a step back and just talk about how these shifts can impact women in general.
Mhm.
And I will focus on the mental health, the mood. So the menopausal transition often involves sleep disturbances, which of course impacts all of us and all of our health, right? Our physical health, our mental health. We don't feel good if we're not getting quality sleep. And unfortunately, quality sleep can be elusive due to night sweats, due to anxiety, due to urinary incontinence, waking up and not being able to fall back asleep. That's very common. And then it exacerbates everything else. Even aside from that, we know that mood fluctuations are prominent during the perimenopause phase. We know that up to 70% of women experience mood symptoms. That doesn't necessarily mean they meet the criteria for a diagnosis of something like major depressive disorder, but that can still be really rocky for them and uncomfortable. And again, women don't recognize themselves. And then, of course, there is the higher risk of depression during perimenopause. Women are up to 2 to 5 times more likely to experience depression during this phase. And they're at higher risk if they've ever had a previous depressive episode, especially around a reproductive event like puberty, postpartum, etc. All that is to say, a woman is potentially, I don't want to, maybe probably, not feeling like her best self. She's tired, she's irritable, maybe full of rage, maybe depressed, and then expected to show up the way that she always has, right? At work, at home, etc. And that can feel really overwhelming. Many women do consider or do cut back or leave the paid workforce altogether. And that is a loss for everyone, not only the individual woman, but also the employer who is struggling to retain this talent that they should really focus on retaining. It's also not good for the economy. But the good news is, and I know I just listed a lot of negatives, but the good news is that there are ways to combat this trend, and there are ways to support women in the workplace and beyond.
Mhm. Yeah, so it sounds like it has some of these cascading effects where it's not just
Mhm.
about the individual woman, but it impacts the work she's able to do domestically or in the public sphere, and yeah, lots of cascading effects. So, what do you think are some shifts that need to occur for women to feel more comfortable in speaking up about how they're feeling and feeling that their experiences are valid and
Mhm.
asking for help, or shifts in expectations during that time.
Women in our culture are conditioned to not ask for help. So I will say that is the first step that we need to take when it comes to menopause care or otherwise. Women experience an inequitable amount of the mental load in a household, even if their partners identify as feminists. We know that women are doing more caregiving, more domestic work, even if they have the same paid work, paid job as their partner. So, in so many ways, we need to undo the conditioning that women need to white knuckle through symptoms. They need to just get through it. They've been through worse. They can get through this, or just quit because that'll be easier.
Mm.
And instead, we need everyone to be more supportive of women with whatever they're going through. And menopause itself, it's a natural life phase. It will happen to everyone who has ovaries and is fortunate enough to reach a certain age. And we need to talk about it, period. No pun intended, because the pun is intended in my subtitle, but I it starts with periods actually, and we need to destigmatize women's health. It's just part of our health, part of our bodies. Everybody has a body. One way to do that that I think is more practical than potential is by encouraging everyone of all ages and genders to advocate for workplace benefits, for example, that help menopause symptoms. And this idea, I think, is important to me personally and professionally. Before I became a mom, I would talk a lot about paid parental leave policies, for example, because I knew, yes, that I would hopefully one day be the beneficiary of one, but I also knew that it was the right thing. And similarly, if you're well past menopause or well before it, or a man, make sure your company or your employer offers menopause related care or coverage or information, anything like that, because that will really change the woman's experience for the better, and the burden won't fall only on her, especially when she needs help the most.
Mhm. Yeah, I like that. And if there are Hopkins admin listening, so we have resources around mental health and balance in
Mhm.
the workplace, childcare, right? But I don't think I've seen anything about life transitions for women, as they reach these decades where they're likely to experience perimenopause.
Mhm.
Um, so, given your therapy hat, what are some of the common um, hesitancies that women have in speaking up and advocating for themselves? I know you said like women are conditioned to sort of grin and bear it and suffer through, but can you speak a little bit to the types of challenges you help women work through so that they can be more confident speaking up for their needs and asking for help?
Sure. Self-advocacy is a favorite topic of mine. And it's okay that people recognize that maybe they're not naturally inclined to do that and they need the support of someone like me, or a friend cheering them on, or a partner coming with them to appointments and saying, wait, we didn't understand that. Can you please clarify or give us more information? It's okay to ask and get support. So I work with women around that initial hump of even asking for the support, and then helping them articulate what support would look like for them and how they can achieve it. Women, I would say, in addition to being conditioned not to ask for help, they're overwhelmed, they're burnt out. So many women I work with are not feeling good, but they don't even know, again, that it could be perimenopause. And then they are empowered by my psychoeducation that I provide around it. But then they're also thinking, wow, when am I going to make this phone call to this doctor and that doctor? And I get it. It's a burden to bear, but that's why we need to train our providers and normalize the conversation. And it shouldn't be a less priority on our to-do list. And I think women need to prioritize themselves more than we do.
Yeah. Yeah, especially for that holistic care.
Mhm.
You hear about, if you want to supplement hormones or even try without hormones, focusing on nutrition and exercise routines and sleep routines, like that's a big time commitment. And so if you have a woman who it works in the home with child care or taking care of the household, maybe works outside of the home in a career, maybe doing both. Like where do you
Mhm.
find the time to factor all of that into your routine? So do you have pieces of advice for how women, like if they want to prioritize their health, what are some steps they can take to start to incorporate all of those things?
So I would say I totally get it. I am a busy working mom, and even if you're not a working mom, we're all busy, we're all tired. But what is the alternative to not prioritizing yourself, not taking care of yourself? It's not good. And I always say start small. You don't necessarily need to do the recommended amount of strength training or exercise per week, but maybe get outside for 10 minutes today and maybe with a friend. And that sort of knocks out a few things, right? The social connection, the fresh air, the exercise. Those are all good things. So don't let perfect be the enemy of good. Just start. Quality sleep is hugely important. Stress reduction is important for our cognitive health, our mental health, and our physical health. And in general, get to know your body and your mood. And if something is new and different, prioritize what you want to kind of tackle first, and we can take it from there.
Mhm. And my understanding is the risk of not addressing these things is that there could be chronic conditions that pop up as women continue to age, right?
Chronic conditions, I mean, they range. I had a friend just this week telling me about her frozen shoulder, which is a symptom of perimenopause. And I don't want to say that everything is due to hormonal fluctuations, but if there's no other reason and you're in that phase of life, then it likely is. And her doctor, unfortunately, of course, was saying, oh, well, you probably pulled a muscle and just ice it. And she didn't. And she was really struggling. And I said, well, you can live with it and be in pain and not pursue the treatments and not exercise the way you normally would. Or you can call someone who specializes in hormone therapy and try something there. So it can be anything from, living with your symptoms, which maybe you can, but do you really want to increased risk of suicidality, which of course is an urgent risk. And women in general, once they go through menopause and estrogen depletes, they're at higher risk of conditions like Alzheimer's and cardiovascular issues anyway. So it's important to know our options. And very often, our options do include hormone therapy. And so our providers should educate us on that at the very least.
Yeah, there's non-communicable diseases, as we call them. So the heart disease, the osteoporosis, the risk for diabetes, like all of these, I understand can be connected to menopause. And if we don't allow ourselves to get into good habits during those perimenopause years, then it could just be compounding our risk for those chronic conditions later on.
Yeah.
Um, so, in some societies, I know menopause is viewed in a more positive light.
Mm.
So, is there anything that you think Western societies could learn from those philosophies and approaches?
Yes, and if there are any media people on here, I would love to do a world tour and interview people from different countries and different communities and learn about their experiences because what I do know and what the research shows is that different cultures and different ethnic groups experience menopause differently. So, for example, American women of Japanese descent tend to have fewer symptoms, while Black women have more severe symptoms for longer duration. in general, we know that Asian cultures are much more optimistic about aging. In Chinese medicine, menopause is considered a second spring, which I love that
I
phrase.
love it.
Yeah, it's often considered more of an opportunity, a beautiful life transition of becoming the new version of yourself, which I agree with. But in American culture, we are afraid of aging. We tend to associate women's value with their fertility, which of course it goes away with menopause. And we're also prudish and we don't really even talk about it, right?
Mhm.
So I think that there's a lot of room for us to improve our cultural perspective, which is not only important on just a day-to-day basis, but also because our mindset can be important for the severity of our symptoms.
Mhm. Yeah. Yeah, in American culture, it almost seems like you're expected to shrivel up and disappear once you reach
Yeah, you
that
become
age, right?
invisible. Mhm.
Yeah, yeah. Women over a certain age become invisible or and are less valued in American society. So I love that you said it was Chinese culture that sees it as a spring, an awakening. So maybe that reframing menopausal years as, or postmenopause as an opportunity rather than something to fear would
Yeah.
be a good lesson for us to learn.
A new chapter, or dare I say, a new period.
Yeah. If anyone would like to come off mute and ask Lauren a question or put it in the chat, feel free. Um, so I know you in your book talk about some crucial steps that all women can take. I know you're targeting millennials in your book,
Mm.
but how do you suggest that other folks in a woman's life, either male partners or families, you talked a little bit about children and workplaces, how can everyone else in our lives support us in this life transition?
So, in general, it's never too early or too late to start doing a few things that we all should be doing, which is normalizing different phases of health, normalizing asking for help, emphasizing good sleep, good nutrition, good exercise. And so, if our partner is saying, I really want to cut back on alcohol and get outside more, that could be inspirational, that could be helpful. I don't want to make broad strokes because I know it's hard, right? It's hard when we're busy, when we're burnt out, and when it's freezing to get outside or to eat a nutritious meal when we have 5 minutes. But if we approach our health as really our lifeline, we don't want to live long without good health. It's not
Yeah.
worth it in a way. Um, I think that will ultimately get absorbed as part of our daily lifestyle. And again, it's going to look different for everyone, but the more open we are with our family members, our partners, etc., truly the better off we will be. I also think that if you can talk to your mother about her experiences, it's predictive, not a guarantee of what your own will be, but it can be helpful to hear. And it can be helpful to hear about the experiences of any older woman in your life,
Mhm.
to learn what they went through, what they would do differently. And it's really, I love hearing and sharing women's stories.
Yeah. Yeah. And not even just women talking to their own mothers, but men could learn from their mother's experiences, or grandmothers can tell their grandchildren, what their experiences are and have this sort of generational passing of knowledge too.
Absolutely. I see in the chat that I'll read it. You mentioned physician training. It seems like the training of physicians focuses on treating disease rather than keeping people well. Yes, that is true in American culture. Helping with menopause, even if there were not a way to treat it, should certainly be viewed as part of women being well. Well, yes, it should, but do you think the reframing the discussion of perimenopause in terms of its impact on wellness might help to normalize it? Maybe. I think wellness as a term has gotten a bit complex. And I think that prevention is always a good idea, and health is a good idea, maybe more so than wellness, but really whatever it takes to reach the patients and the women who are struggling, however you want to label it, works for me. I think there's a provider for every woman. I personally tend to go towards more like Western practitioners, but those who want more Eastern medicine, there are places for that too. I think that women do need to be discerning about information they're getting from social media and realize that what works for one person doesn't work for everyone, and that we really need to make sure we're getting our guidance from reputable sources. But yes, I wish for the day that in our culture we are more about prevention and overall health rather than treatment and being retroactive. And
I don't
then,
know. Oh, I'm sorry. I just wanted to add, I don't
yeah.
know if this exists, but it almost makes me think like we need perimenopause doulas,
Mhm.
like advocates that help us through that period and give us the range of options that are available to us, help us to advocate for ourselves and ask the right questions. Does something like that already exist?
Yes, I would say I haven't come across a sort of organization of perimenopause doulas, but I certainly do know of many menopause coaches and educators and
Okay.
almost like brokers who can direct you. Oh, you are interested in the herbal options. This is the right provider for you, or whatever it might be. So there are options. I try to cover as many as I could in the book. I give a lot of options for the wonderful telehealth platforms that are available that are insurance covered or low fee, like Alloy, MIDI, Electra. The social media, like I said, like anything else, take it with a grain of salt, but there are really excellent providers
Mhm.
out there who are giving information. And again, information and knowledge is power. And I also interviewed Eastern medicine practitioners and others who their approach might work for you. And if it does, then that's great.
Yeah, we had a comment in the chat about many Chinese women making tea with certain plants and drinking that daily to help with symptoms. I know acupuncture is another way of where women will often deal with symptoms, and you can pair that with more Western medicine. Um, but for me, it really feels like an all hands on deck, like whatever it
Yeah.
takes to help you manage that transition is helpful.
Absolutely. As long as it's not hurting you, even if there's no evidence that it's helpful. For example, there was a recent study on CBD and
Mm,
it was kind of inconclusive. It was like, it doesn't really help. But some women swear by it. So as long as it's not hurting you, in my opinion, if it's making you feel better, great.
yeah, yeah, that's excellent.
Mentor pause. I like that.
Yeah.
Cute.
Well, Lauren, I'm very appreciative of you joining us. And it's great to see folks like you trying to destigmatize, perimenopause and menopause and really just normalizing the conversations around this. Um, the destigmatization and the normalization is what's going to allow us to have the audacity, if you will, to go against what physicians are saying and say, no, like this is really something's off, and I need support here.
Mhm.
So the more we talk about it and detach shame from it, I think the more women will benefit.
Yes, and you can see even in this chat how powerful it is to just share and be in communities. So again, I know not everyone is as open and vocal as I am, but there's a place for all of us. There's community, there are resources. You're not alone, and reach out if you need some guidance.
Well, thank you very much, and thank you to everyone for joining us. Um, Sorry, I lost my notes here. If you are not already subscribed to the Gender Equity Unit newsletter, please do so. You can follow us on social media to hear about our upcoming webinars. We are doing this on a quarterly basis now, so keep an eye out for that. Lauren, thank you again,
Thank
and have a
you.
great day, everyone.
Bye, everybody. Thank you.